Professor Lewin, I'm very grateful for your time. There is a lot of panic out there. 24 cases of blood clots is going to scare a lot more people. How do you reassure them?
Well, I'd start by saying that the vaccine itself is really effective at stopping people going to hospital and getting severe COVID, and that's really important. We've got no COVID now, as you say, but we could have COVID entering at any time. We've seen around Asia just in the last few weeks outbreaks in countries that essentially had no COVID, such as Taiwan. So how do you manage the issue of the blood clots, which is a significant concern, absolutely. First of all, 24 cases amongst 2 million doses is about 1 in 100,000, so one person in a fully packed MCG. But second of all, we've got much better at diagnosing and treating these blood clots. They're very different to standard blood clots. And if you give the standard blood clot medicine, you make things worse. You have to know that it's a vaccine-associated blood clot. So we now know exactly what to look for. I think people that get vaccinated also got a higher awareness about this condition, so they're going to their doctors earlier. We hope that every doctor around the country thinks of this diagnosis, because if you think of it, then you can do the right tests and give the right treatment. So really the risk of a very bad outcome, as we've seen one death, which is, of course, we don't want another one, is very, very small. And there really is a real risk of COVID. We're in a great position in Australia, but it could change overnight.
Well, why are some people wrong in your view, or maybe they're not, if they calculate, hey, listen, we're going to wait for the Pfizer vaccine to become available to us? I mean, people say that's safer, although it's now at the moment reserved for Australians under 50.
Well, the Pfizer vaccine and AstraZeneca vaccine, both of them are very good. Both of them stop people getting sick and going to hospital, which is what we want from a vaccine. And we're expecting that we'll get enough Pfizer vaccine in the last quarter of this year, so from around October, which would allow the over 50s to get vaccinated. And I think everyone, as a doctor, I'm very familiar with this, people accept risk in different ways. So I think people have to be comfortable to get vaccinated 100%, but they should acknowledge the small risk of the blood clot, very, very small risk, and the fact that we can actually manage these blood clots very well now, and the potential risk of COVID. It looks like no risk right now, but I can tell you when we had the outbreak in Melbourne and lived through 20,000 cases here, and that was a small outbreak when you look internationally, it was a very difficult thing, especially for the elderly. People do very poorly if they're older, and that's why I would recommend getting vaccinated now, not waiting. Also, if a better vaccine comes along, which is most likely to happen, it will not stop you from getting the better vaccine should we need additional vaccines next year.
And just finally, Professor Sharon Lewin, I mean, you've seen people reluctant to take it. I think it's important that messages like yours get put out there, so I'm grateful to you. But what more can the government do to get through this fear barrier? Is it like set a date for the borders to open so that people have an incentive to get vaccinated so they can travel, or incentive to protect themselves?
Yeah, incentives do work, and different things will incentivise different people. I actually find the most powerful message is hearing that someone got vaccinated who you trust, your friend, your work colleague, your family member. So even you, Andrew, saying you're about to get vaccinated with AstraZeneca is absolutely fantastic. People really respond to personal stories. I think the more we can do to educate leaders in communities, not just doctors, teachers, religious leaders, people that are highly respected in their communities, that can also make a really big difference.